Today we're talking about the top 10 common eye diseases and how to prevent vision loss. Some of these are easily preventable with just a few simple steps, so watch till the end so you don't miss any critical information. No, one is uncorrected refractive errors. This is the most common cause of vision impairment worldwide, affecting over 2 billion people. Refractive errors occur when the shape of your eye prevents light from focusing directly on your retina, which can lead to blurred or distorted vision. This includes myopia or nearsightedness, hyperopia or farsightedness, and astigmatism. The good news is that refractive errors are usually easy to correct with glasses, contact lenses, or refractive surgery like LASIK. But unfortunately, many people, especially in developing countries, do not have access to these treatments because they're either too expensive or they don't know where to go to get them corrected. Number 2 is cataracts. Cataracts are when there's a clouding of the lens of the eye. And this is actually what causes most vision impairment and blindness in the world. Cataracts can cause vision problems like blurred vision, increased sensitivity to bright lights, double vision, or seeing halos around lights. And they can also make it difficult to see in low light or nighttime conditions. Cataracts tend to develop slowly over time, but they can sometimes be accelerated by things like smoking, UV radiation, poor nutrition, and certain medications. Now, if you notice any of these symptoms, definitely see an eye doctor right away. If left untreated, cataracts can lead to total blindness. Fortunately, though, the good news is that they can be effectively treated with surgery. And it's considered one of the most common surgeries performed worldwide. After cataract surgery, the cloudy lens is removed and replaced with an artificial lens, which can immediately improve your vision. Now, coming up at No. 3, we have glaucoma. Glaucoma is a condition that damages the optic nerve, which is the nerve that carries visual information from your eye to your brain. And this damage is often caused by high intraocular pressure, or IOP.
Now, glaucoma can cause a loss of peripheral or side vision, and if left untreated, it can lead to blindness.
Unfortunately, glaucoma doesn't always have any noticeable symptoms in the early stages, which makes it difficult to diagnose. That's why it's important to get your eyes checked regularly, especially as you get older, because early detection and treatment can prevent further vision loss. Treatment options for glaucoma include eye drops, laser therapy, and surgery. Alright, next up we have age-related macular degeneration, or AMD. AMD is a common cause of vision loss in people over the age of 50. It affects the macula, which is the part of the retina that's responsible for sharp central vision. As the name implies, this means that AMD can cause a loss of central vision, making it difficult to see things like faces, read text, or drive a car. There are 2 types of AMD, wet and dry. Dry AMD is the more common form, and it occurs when the macula thins and begins to break down over time. Wet AMD is less common, but it's more severe and occurs when abnormal blood vessels grow under the retina and cause it to bulge and lift up. Both forms of AMD can cause vision loss, but wet AMD tends to progress more quickly and severely. Unfortunately, there is no cure for AMD, yet there are treatments available for wet AMD that can slow its progression and prevent vision loss. These treatments include anti-VEGF medications, laser therapy, and in some cases, surgery. Alright, next up, we have diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina. When you have diabetes, you have high levels of sugar in your bloodstream, and over time, this can damage the small blood vessels in your retina. This can cause the blood vessels to become leaky or swollen, which can then cause vision problems. In addition, the body tries to repair the damage by creating new blood vessels, which can also be fragile and leaky. The good news is that regular checkups with an eye doctor can help detect diabetic retinopathy early, and treatment can help prevent vision loss. Alright, next up we have something called refractive errors. Refractive errors are a group of eye conditions that cause blurry vision because the eye cannot focus light onto the retina. The 3 main types are myopia, or nearsightedness, hyperopia, or farsightedness, and astigmatism. With myopia, you can see near objects clearly, but distant objects appear blurry because the eyeball is too long or the cornea is too curved. This causes light rays to focus in front of the retina instead of on it. With hyperopia, you can see distant objects clearly, but near objects appear blurry because the eyeball is too short or the cornea is too flat. This causes light rays to focus behind the retina instead of on it. With astigmatism, the cornea or lens has an irregular shape which causes light rays to focus at multiple points on the retina instead of just one. This results in blurry or distorted vision at all distances. Fortunately, refractive errors are usually easy to correct with glasses, contact lenses, or refractive surgery such as LASIK. Alright, next up, we have conjunctivitis. Conjunctivitis, or pink eye, is an inflammation or infection of the conjunctiva, which is the transparent membrane that covers the white part of your eye. Conjunctivitis can be caused by a number of different factors, including allergies, irritants, viruses, or bacteria. It's highly contagious, and it can cause symptoms like redness, itching, burning, a foreign body sensation, and discharge from the eye. Fortunately, conjunctivitis is usually not serious, and it often goes away on its own. However, if you wear contact lenses, you should discontinue wearing them until the condition clears up. And if your eye is red, irritated, and doesn't seem to be getting better, definitely see an eye doctor, because you may need antibiotic or antiviral medication to treat the underlying cause. Next up, we have something called presbyopia. Presbyopia is a condition that makes it difficult to focus on close objects, like when you're reading. It happens because the lens of your eye becomes less flexible as you age, which makes it hard to change the shape of the lens and focus on nearby objects. This typically starts to happen when you reach in your 40s, and it gets worse as you get older. The good news is that presbyopia is a normal part of aging, and it's easily corrected with reading glasses or multifocal contact lenses. Next up, we have dry eye disease. Dry eye disease happens when your eye doesn't produce enough lubrication and moisture to keep it feeling comfortable and functioning properly. This can cause symptoms like a gritty or sandy feeling in your eye, burning, stinging, irritation, redness, and it can even feel like something is stuck in your eye. Over time, dry eye can also cause problems like blurred vision, especially when you're looking at a computer screen for long periods of time. And it can also cause corneal damage, which can lead to ulcers, infections, and even blindness. Fortunately, though, there are many treatments available for dry eye that can relieve symptoms and prevent complications. These treatments include over-the-counter lubricating eye drops, prescription medications, punctile plugs, and even surgery. Alright, next up, we have keratitis. Keratitis is an inflammation or infection of the cornea, which is the clear windshield of your eye. It can be caused by a number of different factors, including bacterial or viral infections, fungal growth, or it can be caused by wearing contact lenses that are not clean or well-fitting. Keratitis can cause symptoms like pain, redness, discharge, blurred vision, and it can even cause complications like corneal ulcers and scars, which can lead to blindness. Fortunately, though, most cases of keratitis can be treated with prescription medications such as antibiotic or antiviral drops. Now, I didn't have time to go into detail about all 10 diseases today, but I did a full video about all 10 with details, so check it out here. Also, if you found this video helpful, please hit the like button. And as always, thanks for watching.